Tell us who you are and what you do and what you expect out of this.
My name is Monica, and I'm a third-year student here at HMT. And I just want to learn how to help people with pain since I'm just starting out, and I haven't experienced too many people with pain. Usually I get more anxiety and depression for some reason, but I would like to learn more about helping people with pain.
Well, this very much treats anxiety and depression. Mm-hmm. And anxiety and depression is very much talked about in my book. And as you know, anxiety and depression is very much the earth element, anxiety and depression. And even how do you balance your earth and how do you center yourself? And in my experience, anxiety is always worry about the future. Depression is always disappointment about the past. And what we need to do is learn how to be present in this moment. And when we do get completely present in this moment, then it calms us down, it centers us, it grounds us. And so a lot of my patients have anxiety and depression. And I have ways where I work on it because the anxiety and depression very often manifest as, if not pain, tension somewhere, or indigestion, or headaches. And so I work on headaches, indigestion, irregular bowel syndrome, pain in the lower back, of course, the anxiety or the depression. But understanding, not just treating the anxiety or depression, figuring out why, and teaching them the pattern. So much to me in this is that acupuncture points are like circuit breakers. And the key is to find the right circuit breaker. If you find the right circuit breaker, you should have results right away. The problem is, of course, how do I find the right circuit breaker? There's a lot of circuit breakers. And so finding the right circuit breakers for me is not hard. I expect every single person come in to feel better immediately when they leave. What's harder is teaching them how to live, not to blow the circuit breakers again. This is more, to me, an art. And if I could do that, I give them homework and assignments. So my patients cannot, I have a 5 weeks waiting list, 4 to 5 weeks waiting list. And when they come once, and they don't come for another 4 to 5 weeks. And the average visits is probably 3 visits of a patient. Now, I do have people with chronic or degenerative pain, and they might still come once a month, and they keep coming, but it's for them to manage and to learn. And very often, it's because they're going through something, some stress in their life too, and there's something they have to learn. So it becomes like a spiritual practice too for them. All right.
Hi, my name's William, and I'm here just because I find this kind of work to be really fun.
Okay. Are you a student, a professional? Yeah. First year, second year, third year?
We're in a third.
Oh, okay. So you're going to graduate pretty soon then?
Yeah.
All right. What do you expect to get out of this? Just learn more or what?
Just learn more.
Yeah. All right. Thank you for coming. All right.
Hi, my name is John Goodman, and I'm a chiropractor, second-year student here as an acupuncturist, and I have a diploma in applied kinesiology.
Oh, okay.
I've been studying for 19 years, using it for 19 years. And I've heard about you a long time ago, maybe 12, 13, 14 years ago, I don't know. I want to say maybe through standard process, I have a little tape where you're talking like a mile a minute about don't do this, don't popcorn, don't do,
No, that probably wasn't me, but I did work a little bit with standard process. But I know a lot of people who work with standard process. But
well, I know patients that also have gone to you. Cycle my way, so I've known about you.
It's very interesting. HMT is actually a merger of acupuncture and applied kinesiology, and back in 1984, I actually talked to George Goodhart on the phone, and he was very concerned at that time because there was different forms of kinesiology popping up all over the place, and he begged me not to call it applied kinesiology, and I respected him for that. I said, that's fine. So I never did, but when I was in Sweden, I studied with Sheldon Deal, which was at that time the president of ICAK, and I was the one teaching the basic AK class to the therapist in Sweden before he came, and it was his letter of recommendation that got me a job interview in California. So Yeah, so you'll be very familiar with this. It's kind of right up your alley. Yeah. Anything in particular you expect to get out of this?
I'm just here to listen and meet you. Really.
Yeah. All right. Well, thanks for coming. All right.
Hi everyone, I'm Nusha, and I'm a first year student here at HMT. I do acupressure and Tuina and emotional healing, and I'm an athlete myself, and I've been getting more patients with, or more clients that are athletes as well, and it's something I'm really interested in, so learning different techniques to relieve pain I think is really beneficial.
Yeah. Yeah. Oh, thank you. Well, I started pretty much because of sports medicine, because that's what I was into, and I do work on professional athletes on a regular basis. But the interesting thing that every single component, every single injury has an emotional component, and so HMT, and especially when you bring in the four seasons, work very much with emotions, um, and we'll talk about that a little bit more later. So thanks for coming. All right.
Hi, I'm Namalia. I'm a psychologist who works from a holistic and somatic perspective. So I do a lot of different kinds of craniosacral therapy, shiatsu.
Yeah.
I'm a second year student.
All right.
Chinese medicine. Claire has been so excited about you, and I'm excited because I know that everything has an emotional, everything has an emotional
Yeah.
underpinning, so pain
Yeah.
and trauma.
Yeah.
I do a lot of work with sexual abuse trauma.
Oh, yeah.
So I'm
Yeah.
really excited
Yeah.
to be here, and I've gone on your website
Yeah.
to see what you do in the course that can be utilized
Yeah.
to work with trauma
Yeah.
and emotional dysfunction.
Oh, thank you. Thank you for coming. You have very interesting, you're merging a lot of different techniques. And I have a lot of respect for craniosacral therapy. And it's very, very subtle. And you have to have very, very good sense or intuition and feel. But the results could be remarkable. Um, HMT is kind of on the other sense of the spectrum, because in craniosacral therapy you hardly feel what's going on. You will feel this. You will wake up when you get a treatment. So, but both of them, of course, can work. And like I said, the philosophy of the four seasons, which is really the five element theory, the way I explain it, I like to explain to all my patients also cause and effect, and also understand, believe in a purpose. People with pain, and even people that have horrible things happening, once they could stop being victims and see how the event actually could make them stronger, and they find a purpose in what happened, then they are growing spiritually, and they could also heal. And so I think a lot of it, that's a very important part. I get people like that, but when they come to me, they don't come because of that. They come because of pain. But as I'm working on them, I'm able to figure things out about them, and sometimes it just comes up, yeah, that is a big source of tension and pain and suffering. So thank you for coming. Yeah, yeah, yeah.
And
Yeah.
I honestly feel like kind of scientist of the emotional body at this point.
Yeah.
I've gone through a lot of stuff myself, and in doing that, I become more capable at dealing with the underworld of other people's emotions. And so as a result, I've been doing a lot of just donation only or even free EFT sessions to help people in my community and my friends get through whatever they're going. And so I've actually I've had success at treating people's pain through just doing tapping around whatever their pain is and finding that there's an emotional cause. I also, too, on a practical level, want to learn how to be booked 5 weeks in advance to deal with people's emotions and physical connections.
Well,
It's something fascinating to me.
Being booked 5 weeks in advance is a blessing and a curse at the same time. In the beginning, it was very stressful for me, because people used to call and cry and beg me to stay over lunch, to stay after, or come on the weekends, until eventually I realized, no, I just have to. So I've come to be at peace with suffering in people. I happen to believe all suffering has a purpose, and I also happen to believe that everyone that's supposed to see me will see me. And so I feel sometimes almost like the captain of the Titanic. The ship is going down. I have 800 lifeboats, but I have 8,000 people, so I could only save the ones I could save. And when I leave, I have to leave. I cannot take them all with me in my head because I need to go home and sleep and rest and recover. So it is a blessing to be busy because at least you're not worried about that, surviving. But it's also sometimes stressful when people want to come in and you can't. So.
Thanks for that.
Yeah. Now, Claire, I know, but you might want to tell them.
Well, I might want to say what I want to get out of this.
Yeah.
So, my name's Claire. You guys all know that. Toby, the one reason I got into Chinese medicine, and what I would like to get out of this is how Toby's saying there, he can only handle 800 out of the 8,000. I'm just hoping more people in Chinese medicine can get into what he's doing, and we can help relieve more people with more pain. And I'm just hoping to get his name out there and what he does out there, and it might not be for everybody, but I think that it's incredible. And so I want to spread the education about him in Chinese medicine. That's my goal.
Well, thank you. Claire came and she wanted to do what I was doing, and I said, well, you probably shouldn't do what I do, just have, because obviously I have a degree in acupuncture, but it wasn't recognized when I came here, and I wasn't smart enough to check that before I left. So when I came with, and as I'll tell you later about that, I had to operate not having a degree, and it's so much easier if you are an acupuncturist, a chiropractor, physical therapist, a doctor, athletic trainer, because you have an organization and you're accepted and you're acknowledged, and then work from this, learn other techniques. Many of you, I don't know how it is in your acupuncture school, but I know a lot of chiropractors and physical therapists know that when they graduate, they're not ready therapists. Now is the time you start taking all the courses. That was just to give you the license so you could practice. So it becomes a journey, of course, where you're helping people to the best of your knowledge, and you're trying to learn more traits, and then you become better and better and better at what you're doing. So thank you, Claire.
Hi, I'm Jason. Thanks for coming here. I'm also a student here, and I'm a body worker, and I'm friends with Claire. She's talked a lot about you and your technique, so I'm excited just to be here to learn.
Oh, thank you.
Incorporate. And as far as like what I'd like to get out of it, I think just kind of getting a broader sense of what you do and learning, because I know that your background is in Chinese medicine.
Yeah.
And like learning how to communicate with just getting like a new set of language to reach people that maybe don't necessarily fully step over to like Eastern medicine.
Yeah. Well, thank you. I think that's what HMT is, really, to be a bridge, between the different forms of medicine, and then we're going to talk about that. So, thank you for coming. And we did all this just for you. We've been keeping talking here because we were waiting for you. So, so we're just gonna finish up. So, so while you could listen to the last two, and then you could say, and then we're going to start the workshop. So they're basically telling me who they are and what they do and what they expect to get out of this presentation. So,
my name is Bill.
Yeah.
I do want to thank you for coming and spending some time with us.
Yeah.
I'm here because I smelled the cake from downstairs. I met Claire when she came to the school in an open house when she was a prospective student.
Yeah.
And even at that point, she was mentioning your name and mentioning her experience with you as a patient,
Yeah.
and how that was her motivation for coming in.
Yeah.
And her enthusiasm has been infectious ever since. So we've had this opportunity to welcome you here today. And,
Thank
I'm
you.
interested to hear what you've got to say and what your experiences are.
Thank you.
And how I could apply that clinically as well.
Yeah. Well, thank you.
My name is Jamie, and I'm a student at school, as well as I have a neuromuscular practice, and I use applied kinesiology in my work as well.
Oh, okay.
And so Claire's told me a lot about you as well, and it sounds kind of like a bridge of what I do in acupuncture, which
Yeah.
is
Yeah.
really
Yeah.
interested in finding that
Yeah.
combination.
No, it's actually perfect for you. So are you here at the acupuncture school? Are you studying? Yeah. Yeah. No, you would probably have one of the easiest. You and the gentleman here that have studied applied kinesiology will be very easy to just segment into this almost right away. And then you. Who are you?
My name is Tierney, and I'm also a student here, and I'm also a good friend with Claire.
Yeah.
I practice Tuina.
Yeah.
And I'm interested in kind of like learning about. She just raves about how this technique is so good for pain. She's actually tried it on me.
Yeah. Yeah.
So yeah, I want to learn more.
All right. All right. Thank you. So I guess we'll start. So, so some of you heard this from the beginning. My background is in acupuncture. I started at an acupuncture college in 1981. It was a 3-year college. It was in Stockholm, Sweden. And when I started in acupuncture school, the school we went to, they also had applied kinesiology. It was one of the things that was taught. So for those of you who don't know what applied kinesiology is, it was developed by a chiropractor named George Goodhart. And basically, he took the concept of muscle testing, the way physical therapists test muscle testing, and he actually turned it into an applied therapy. In other words, he didn't just test the muscle and determine it was weak. He tried to find where on the body do I stimulate to make this muscle strong. And he found different reflex points that when he touched them, he could actually strengthen the muscle. Okay. So, so the important thing with applied kinesiology then is that they used it primarily for adjusting the spine. They used it to determine which ways to adjust, which parts of the body need to be adjusted, how they need to be adjusted. They also used it for nutritional testing and testing of herbs and testing of all kinds of nutritional products as a feedback mechanism. In other words, they could see if by introducing a supplement or tasting it, if it would actually strengthen a certain muscle. Okay. And so applied kinesiology was part of what was taught at the school as well as reflexology.
She wants you to try it again.
Okay. All right. So now let's go on with the show. All right. So in the school there was teaching acupuncture, applied kinesiology, reflexology, acupressure, massage, and we also studied regular medicine. So we had anatomy, physiology, internal medicine, similar to what a nurse would get in Sweden at the time. And one of the things with me, I came from the background, it was in the early 80s, I was interested in bodybuilding, watched Pumping Iron, me and my friend was working out, then we learned applied kinesiology, now you could test the muscles. So now we know how to train the muscles, how to test the muscles, and I was looking for some way in sports medicine, how can you get the body to perform on its highest level? How can you get the body and the functions to improve? That was my start. And then when we came into this introduction from the acupuncture college, and I learned about the yin and yang, about the law of the 5 elements, I was just fascinated. The concept that everything is energy. I mean, we teach it in science, but we never really practice it. But in Chinese medicine, it's practiced that everything is energy, or qi, okay? And the idea is that if everything is qi, then every disease, every injury, every emotion is a form of energy. And if there is something that deviates from what's the optimal or from what we want or what's healthy, if there's any injury, disease, or anything that's not working, obviously there's a blockage in the qi somewhere. So then just the concept that here there's 700 listed acupuncture points. If you add the ashi points, which could be multiple ashi points, and every single muscle could have ashi points, and extra points, you're probably over thousands of points, or 1,000 points. And the idea then, if you could find the right point to remove the blockage of energy or to stimulate the energy, that you could get immediate changes and you could get someone to feel better immediately, was just astonishing to me. how the master could observe the patient and just use 1 or 2 points and get immediate changes. So I was very, very fascinated by this whole concept, the hypothetical theory that everything is energy, and if I find the right circuit breakers, I should be able to make changes like that. What I was not having a lot of patience with was post-diagnosis. To me, I was very impatient at that time. I'm still working on it, but I wanted to find another way to select the points, because it was also hard to understand. We had Chinese teachers, we had an interpreter from the Swedish embassy for the Chinese embassy in Sweden that spoke Swedish, and the interpreter didn't know anything about acupuncture. He just knows Swedish and Chinese, and then so when this communication went on, when he's teaching, she speaks in Chinese, we're sitting there, the interpreter interprets to Swedish, and then we're sitting there, huh? What is that? Jagged, pulse, whatever those pulses was. Then we had English teachers from the British School of Acupuncture that also came in, and they were teaching us things. And I was told that it could take up to a man's age or 40 years to master post-diagnosis, and I figured there's got to be another way to figure out which points to use. And so my whole idea then, what about applied kinesiology? You ask the body, you test the body, you test the response of the body by testing a muscle. You find weaknesses in the body, and you introduce different forms of energy, and you see how the body responds to this, and you get changes. What if you merged the two of them and used applied kinesiology as one way to find the points? And so that was one thing, but then applied kinesiology, for those of you who might have seen it, it could become almost like a little bit of a parley trick. People come up and they test someone, they're strong, and they give them a little bit of sugar and they're weak, and it becomes almost like something they're showing us tricks. And they say, try this supplement and now you're strong. And the thing with that applied kinesiology is so amazing. It's a very sensitive tool where you ask the body question. But how are you 100% sure that the question you ask is the question that they are answering? Since I could think a very negative thought when I'm tested and I could go weak, and I could think a very happy thought and I could go strong, that when I then introduce something, how do I know for sure that the result I'm getting is always the right one? So it was hard to just do this with only applied kinesiology to test, because people start thinking, you're pushing harder, oh no, you made that happen. So I needed something, a framework, something that everyone could see, something that everyone could touch, something that everyone could learn right away. And I'm realizing that the muscles, and I was fascinated with muscles, I love muscles, I still love muscles. My wife is a personal trainer, and she competes in physique and bodybuilding. I've been working out for 40 years. But I just think the muscles and this muscle system is fascinating, because not only of how our body function, but also that muscles is like an armor of the body. And we all have the muscles. We might not see them. I don't know if any of you saw this big show that was done in San Jose not long ago, the one where they strip people of their fat and their skin, and you see people put in positions of doing sports or whatever, and basically you see all the muscles, they plaster it or something. Anyone see that show or heard of that show? Yeah. It was fascinating, and I was teaching a class, and one of my students said, did you see that show? I said, yeah, I saw it. And says, isn't it amazing? All those guys are all joked, have muscles, and they all have six-packs. I said, well, everyone has six-packs, it's just you can't see it. And so we all have those muscles. We might not see them, but the muscles is what helps us move forward. It is what helps us perform, and it's also an armor in the body. So in this armor is where we hold tension. So why couldn't we use these muscles to determine where the tension is? So we could pick the points that we need to do, so we could make changes in the body and get immediate results. So that is what happened. I start immediately looking for my way of doing this. I also took the book, The Law of the Five Elements. That was like a Bible for me in the beginning. And I read it and I practiced it, and I always ask my patient questions. And then As I learned, I figured out a way of how to explain this 5-element theory in a way so that a person in our society could just pick it up without any previous training and read it and understand how they're actually responsible for their own actions. So if everything is energy, then everything is cause and effect. And HMT, which stands for hands-on, hands, also happen to be my name, hands-on, muscle therapy, because I'm using the muscles to determine where the tension is. And I'm using the muscles to ask the body about where I should apply the treatment. So I have old ladies of 90-year-olds or kids as patients. I don't only have athletes. And so you could use this on all people. How much you apply pressure on the points is, of course, based on what the person could tolerate and where the level is. But so then the interesting thing then is stress is the cause of pain and suffering. Okay? This is all stuff you know. This internal and external challenges in life. This is internal and external stress, which you guys would call internal and external chi. Okay? Stress is either real or perceived. Now, the physical stress factors is all my patients to come in. Everyone thinks, oh, why are you in pain? Oh, I bent over and lifted this bag wrong. Oh, I've been sitting in front of the computer 8 hours a day, 5 days a week. That's why my neck and arm is killing me. Oh, I have a 2-hour commute. That's why my lower back is killing me. So people tend to naturally think the reason they're in pain is always because of physical stress, which is actually not the case. There's always other components. And we're going to come to that in just a little bit. Actually, we might as well cover that right now. For example, physical stress then is, for example, a direct trauma, a car accident, hitting something, a whiplash, running into this table in full speed, getting a contusion, getting a bruise, getting pain, getting inflammation. The muscle might contract, it might pull more on the kneecap. The kneecap gets compressed into the joint. I'm getting tendinitis. I get pain now when I walk up and down the stairs. That's a form of physical stress. Direct impact or trauma is one. The other one is repetitive use, sitting and typing all day long. Of course, this gets worse if the posture is poor, because if my head moves from here to here, it's like holding a bowling ball out here. The head weighs 8 to 12 pounds. If I hold it here, I'm going to get very tired. If I hold it here, I could hold it a lot longer. So needless to say, if my posture is like this, there's less strain on my body. If my head is like this, well, my head is not going to get any lighter and gravity is not going to go away. So obviously it's going to be strained to my muscles. But what affects this? Is it then only that I sit and work in front of the computer that gives me pain? That's what people want to believe. But how come that sometimes you can sit in front of the computer in bad posture and you're so into what you're doing and you have no pain whatsoever? Why is that? Well, there's different factors. For example, if you sit in front of the computer and you are not happy with being in front of the computer, if you're doing something that you don't want to do, that you don't like doing, if you don't believe in what you're doing, if you think that you're not good enough what you're doing, if you think that you have too much to do, not enough time, if you're overwhelmed, if you're thinking of 10 things at the same time, if you're not breathing right because you're stressed and you're breathing shallow using muscles in your rib cage and your neck, then it hurts. So in other words, the state of mind you're in when you're in front of the computer is as important than being in front of the computer. Because otherwise it would be illegal to sit in front of a computer if everyone hurt themselves when they sit in front of a computer. So this becomes very important, the state of mind. Think about this, for example. We'll come to that in a little bit. So that's the physical stress. Direct trauma, impact or injury, repetitive use. Then we have nutritional or chemical stress. Am I getting all the protein, all the carbohydrates, enough healthy fat? Am I getting enough water? Am I getting chemicals, processed foods, coloring things? Am I getting too much fat, too much sugar? Am I using drugs, recreational or or pharmaceutical, all of which could cause stress to my system too. Now, how could that cause pain? Well, if I lack something, if I, for example, don't drink enough water, I get dehydrated. When I get dehydrated, my muscles contract more. If all my muscles contract more when I'm dehydrated, the muscles where I already have stress, the circuit breakers that are already compromised, is where I'm going to feel it the most. Very often on the bladder and kidney meridian, in the calves, in the hamstrings, the back, and so on. So dehydration could cause physical pain. Lack of water could cause physical pain and back pain. And of course, if I eat too much sugar or too much fat, you know, my blood sugar spikes up or down too much, and my emotions change, and you know, I get anxious or tense or whatever, then I could cause tension and pain because of that. If I drink too much coffee and I get too amped up, you know, I get anxious, I'm not breathing right, I'm tense. That might cause my neck pain that I have to get worse too. So nutrition and chemical stress could cause physical pain, okay? Then we have environmental stress. Bacteria, virus, pollen, allergens, all of this. Now, why is it, for example, that one person gets sick and another person that was next to the same person didn't get sick? Well, because one person's immune system was more compromised than the others. Well, why is one person's immune system more compromised than the others? Because they're not in balance with their surroundings or within themselves. And so that has caused them stress and tension, and therefore they're more susceptible to get sick. So the same thing with allergies. If your diet is good, your allergies are not as bad. If you're happy and have less stress, your allergies are not as bad. So we see how all the different stress factors affect each other. Now, mental and emotional stress, which I happen to think is the biggest factor, because unresolved past mental emotional stress or current ongoing mental emotional stress is causing a chronic tension. And it's almost like the body has like a muscle memory, that whenever you are consciously or subconsciously reminded about this, a song on the radio, an aftershave, smell of a perfume, a time of the year, suddenly you start tensing up there. And so now you cause those old circuit breakers to flare up again, and you start having those symptoms again. Belief system. People are so often stressed because they believe in something that is stressful. You have a job that you hate, that you don't like, but you think you have to do it. How are you going to feel? You're going to be frustrated, resentful, and angry, and you're going to be tense. You have a 2-hour commute and you hate sitting in traffic. How are you going to feel? You're going to be tense. What if you find perfect peace when you're sitting there? It wouldn't matter if it took you 2 hours to commute. It'd be your sanctuary. But your state of mind and what you're thinking at the time, because you're doing something you don't want to do, is causing you tension. If you do something you don't believe in, I'm in a marriage, I don't really love her, but I'm going to make it work. I'm going to, I don't really like her, but I'm going to just hold it together because we're supposed to be married, and I'm trying to fake it. You can't do something if you're not into it. It'd be like working at DMV or post office and hate it and just staying because of your retirement, Now you take long smoke breaks and you gossip and you're not into it and you don't like it. So obviously you need to be into it, you need to enjoy it, whatever you're doing. If you exercise, you can't get results unless you enjoy exercising. If you hate it, you're not going to get any results. So that if I believe I have to exercise because I'm fat, but I hate it, how am I going to feel? I'm going to be miserable. I'm going to be out there running and hating every minute of it, So what I believe, the belief system I have, what I'm thinking, the emotions I have, past unresolved emotions and past things we believe that is not healthy. If I believe I'm not good enough and I beat myself up all the time, then I'm going to repeat a cycle over and over again, and I'm going to blow the same circuit breakers over and over again. If I believe I'm running out of time, I have too much to do and not enough time, how would I feel? Overwhelmed, stressed, I can't rest, I can't fall asleep, and I'm falling asleep, I'm exhausted, but I'm like I have post-traumatic stress, I'm waking up and I'm a light sleeper and I start thinking about stuff again. So that's how come that factor is so big. It very often overrides the physical pain. I tell very often my patients, I say to them, let's say you're in excruciating pain. The phone rings. In agony you reach for your phone. You've been waiting for this call for a month. You see the number, you recognize the number, it's the call you've been waiting for a month, and you get very excited. What happened to your pain? It goes away? Well, does the pain go away, or does your mind go to a different place? And if your mind goes to a different place, who makes the mind go to that place? So this is where the education comes in of patients. Because all stress is the cause, and stress causes tension in our body and in our mind, and this causes pain, suffering, injury, and disease. So this is the effect, this is the cause. But we live in a society where we've been trained to treat the cause, to treat the effect. We don't really, I'm not talking about acupuncture school now, but if you look outside, 90% of the people, they don't have health care, they have sick care. They have a headache or pain, they take pain pills or anti-inflammatory. They have acid reflux, they take anti-acid. They have anxiety and depression, they take antidepressants. So they take a pill, and we've been kind of or those people outside there have been brainwashed to believe that my cure comes from the outside in the form of a pill, and people have not been taught that they have a responsibility for the tension and the pain they have. So in HMT, you learn how to take the pain away, but the bigger thing is you also learn how to tell and teach the patient what they are doing to blow the circuit breakers. It is not hard to reset the circuit breakers. Like I said before we started here, almost every single one of my patients walk out feeling no pain or significantly less pain. I expect it from every single person walking in the door. What's harder is to make sure that they stay that way. So not only if I could find the circuit breaker that is out, if I could release the tension in that circuit breaker, so that the function, the person cannot lift their arm, oh, now they could lift their arm, and the pain is gone. But if I could also tell him or her what they're doing to make that circuit breaker go out, what kind of behavior pattern they have, what beliefs they have, and how they could change this. Now I'm really empowering them. It's like I'm teaching them to fish instead of just giving them fish. And it's funny, I was teaching this class to chiropractors too, and I said, well, the average visit I have is probably 3 visits, unless for the chronic people that are coming, but there's kind of more like they're going through some things in their life, and it becomes almost like a spiritual journey too. So maybe 70% of my patients is better in about 3 visits. I said, what do you do when they get better in 3 visits? You have no patience. And they're so trained to think that you have to tell people to come back. And I say, no, I just want them to be done. They could come back if something else happened. And they're going to tell all their friends. And then they're going to come in. Like I'm going to run out of people that are in pain or suffering. It's not going to ever happen, you know? So I'm not worried about that, but this is what's so important, cause and effect. So stress, tension equal pain, injury, disease. Cause, stress, tension, pain, injury, disease, effect. Same thing as Einstein said, energy equals matter. Everything is energy. The Chinese didn't talk about cause and effect and energy like Einstein said, but they talk about qi being the life force or the energy, and they talked about lin being a pattern. And they studied patterns of health and patterns of not being healthy. So when a patient comes to me, I am observing them. I'm observing their body, how they look, where they hold their tension. And I do this by observing their posture. Is the shoulders high? Is one higher than the others? Are the arms turned in? Are the shoulders and head slouched forward? Is the butt sticking out? Are they arched like this? You know, all those things I'm observing. I'm observing the range of motion. Can they move their arms and legs and necks and back in the position what's considered normal range of motion? Because the posture and the range of motion is telling me where the tension is. I test the muscles to find out which muscles are weak, and which muscles are weak because they're too elongated, which we're going to show later, which ones are weak because they're too contracted. And I look at where is the pain, which meridians is this following. Okay, so the patterns, recognizing the patterns is really the key, because if you could recognize the patterns and tell the person about the pattern, you could help them. So as you know, this presentation is given for physical therapists and chiropractors, and it's really an honor for me to be back here with you. It's 32 years since I was teaching at an acupuncture college. I was the teacher at the school where I went through. I was part of the faculty. I was teaching the first grade. I was teaching the 5-element theory, and I was also teaching applied kinesiology. And it's taken me this long to get back to an acupuncture college, but it kind of brings me back to my roots, which is really fascinating. But when I'm teaching this class to physical therapists or chiropractor or athletic trainers, they know everything about the posture and the range of motion and the muscle test. They know nothing about the meridians and the acupuncture. Now I'm teaching it to you. You know everything about the meridians and acupuncture, but you're not familiar with the posture and the range of motion. And think about this, because HMT is a bridge between East and West. The problem with acupuncturists and Western medicine is that they don't speak the same language. Now there is a lot of doctors who figure acupuncture could work, but it's almost always the last one. Well, nothing else works. Let's try some acupuncture. I don't know what they're doing, but go over there. But when they communicate with you to say, oh, this person has a shoulder impingement, they have an acromion impingement, and they have a slight rotator cuff tear, and they have a limited external rotation and limited flexion in the shoulder, and you guys send a report back, well, they have a stagnation in the lungs, and they have stagnated blood, or whatever terms you use to say, and this doesn't match. There's little chance that the doctors and orthopedic surgeons is going to learn your language, but what if you learn their language too, and you could use posture and range of motion and communicate with the doctor what posture and range of motion that is not right, and then correct this using the acupuncture points. Now it just opened up a huge thing. It's like sports medicine and acupuncture. Open up a whole new floodgate of business, basically. So as you know then, 5,000 years ago, the Chinese acupuncturists became aware of the sensitive reflex points. Those reflex points become sensitive whenever harmony was lost. Stress or tension overload caused sensitive reflex points, and this is similar to a circuit breaker in my vocabulary. That's what I call it, circuit breakers. And the patterns of dysfunction, pain, injury, disease was discovered, and the Chinese talked about two types of reflex points, the acupoints and the ashi points. And I might be misinformed this one thing, but I was told one time by the interpreter from the Chinese embassy, from the Chinese lady, that ashi meant ouch, that's the spot. I don't know if it's true or not, but it sounds like it. And if you think about it, if you find a spot and you push, ouch, that's the spot. You know, and when you hit the needle in it and they could feel that chi sensation, or when you push on it and they feel a jolting pain and they jump, that's kind of like, oh, you found the spot. And the acupuncture points, as you know, all are fixed. They have their own location, they have their own exact anatomical location, and you're all trained, you know where they are. They have a Chinese name, and then later on, when the French came to China and discovered it, they put numbers on them and called them based on the meridian they were connected to, because it was easier for Westerners to memorize this instead of memorizing all those names. Okay? But the Ashi points do not have fixed anatomical location. They could occur anywhere in the body, in any muscle, tendon, or ligament, wherever there's a soreness. So if I run into this table, like I said before, and then I get a sore spot here, I have Ashi points there. So in HMT, it doesn't really matter if it's an acupuncture point or an Ashi point, because the treatment is the same. The idea is to release tension from a point that has an excess of tension. And what we're dealing with is not points that you know as insufficient chi. We're dealing with points where there's a blockage and there's excess chi. And what I was taught in acupuncture college was that we used a needle to disperse energy, and first you had to fish around for that point, and when you find it and you got the chi sensation, then you're supposed to do some pumping movement there to release that excess of chi. Now, HMT is very much like that. We're looking to discover where is the excessive energy, the blocked energy, to remove that. And when we do that, the flow of energy could be restored. Obviously, then there's going to be some points where there's a blockage, and there's some points where there's not enough energy. But by releasing this energy, then it's restored. And as you know, if the person have too little energy, they might need nutrition or herbs or something to raise their energy level. But this is talking about finding where the blockage is and release the tension. Okay? So, this is what I love. There's only one disease, its name is stagnation. There's only one cure, its name is circulation. That's, to me, is the essence of acupuncture. And that, to me, is what makes it so fascinating. And that is what I want to find. I want to be able to find the point, the person is in pain, how could I fix it right now? Where is the stagnation? And so, again, all of this is stuff that you know. The ancient physician believed that the human body could cure itself once the circulation and harmony was restored. And treatment consisted in finding the blocked, short-circuited reflex point and release it of tension to restore the circulation. And the ancient Chinese treatments are puncturing the blocked reflex point with needles, which is what you learn here, mechanically breaking up the tension with digital pressure, which is acupressure, cupping to restore blockages, changing the diet, prescribing remedying herbs, practice of Tai Chi, Qigong, and medication to move energy in the body and become aware of that energy in the body. And then the one that I think is the most important one, which I believe has gone lost a little bit. Because the master is teaching the patient what they need to do to restore their balance. Teaching that what is the proper way in life. What are you doing that is blowing out the circuit breakers? Now, I find it, again, this was things that I was told. I was told back in the ancient times the village had an acupuncturist, and everyone paid him all the time, and when they're sick they could go as much as they needed to. Kind of like a healthcare system almost. And also that the emperor had his own acupuncturist. And the book, Nei Ching, is basically the communication between the Yellow Emperor and his acupuncturist. And in those days it was said that the emperor, if the emperor died, the acupuncturist has to die because he failed. He's supposed to keep emperor alive. But so basically, to me, when you could teach the proper way, then that's the most important factor. And so that's what is kind of like the spirit of HMT. There's the body of HMT and there's the spirit of HMT. Now let's go to Western medicine. This is the things that perhaps you are not as aware of, but they did find reflex point in Western medicine too, and they're called trigger points. And perhaps the one that is most known for this is Janet Travell. She was, among many things, the doctor for John F. Kennedy. And she also did a lot of research on the trigger points. And she said that trigger points is basically hypersensitive spots in the muscles, tendons, and ligaments. And they're caused either by trauma, overload, organ dysfunction. Interesting, huh? How did she find out there was an organ dysfunction could cause a trigger point in the muscles? Well, Travell was doing treatment in her research stages to a lot of people that had cancer. Cancer in the kidney, cancer in the lungs, cancer in the bladder, cancer in the uterus. And as you may know, people with cancer, the worst thing they had with dealing with disease was not the disease, it was the pain that came with the disease. And what Travell found was that trigger points to cancer patients could remove the pain they had and help them deal with trying to heal from the disease. So obviously trigger points is not healing cancer, but it's helping the person deal with the pain. And so there's a organ surface connection in the body. And so when the organ is dysfunction, reflex points established on the surface of the body with tension, and those are active trigger points. And what she found was treating those trigger points helped the person's pain that they had because of the cancer go away. So she found there is a connection between those trigger points and the organs. Joint dysfunction. What they found was if a person had arthritis in a joint or a degenerative disc, that because of this joint not functioning, the muscles tensed up and compensated because the person was favoring one limb or another. And this caused trigger points. And she also found that when people were in anxiety or depression or mental emotional stress, they developed trigger points. And here's the interesting thing. So Travell now, not knowing about acupuncture, found out that there was reliable referred pain patterns. In other words, where there was a trigger point, and I don't know how well you could see this, but on this illustration here, you could see the X's being the trigger points. And so that's where the trigger point is. The blue is the pain pattern. So we see one here causing pain more in the buttock, in the back of the leg, one causing pain in the hip and the side of the leg. And we know that's the gallbladder and the bladder meridian. Now Travell then at some point was told, hey, this is just like the acupuncture meridians. But what she did, she then compared all the pain patterns to the meridians and found out this is not right. This person has pain. I pushed the scalene trigger points, and they have pain down in between the shoulder blades, and there's no meridian that goes from here into the shoulder blade. But she didn't know about the tendinomuscular meridians. So what she said, well, it's not really the meridians because it doesn't fit the pattern all the time. But they found that the pain does not follow the neurological pathways. So they were kind of a little bit stunned. I mean, what is this? There's no nerves that travel like this. So they call this referred pain patterns. And the trigger points is the same thing as the Ashi points as we know it. Now they could occur anywhere in the body, but Travell discovered there's some trigger points that are common. They don't have an exact pattern, but they have common locations. And they have common pain patterns. And the pain patterns she discovered are those. So I could go in and I could find a trigger point in the gluteus minimus, and I could recreate this pain down in the leg as I'm working on this point. And if the person comes down and say, hey, I have pain in the side of my leg down by my knee, and here's where my pain is, and it's happened to come from a trigger point up here. And when I work on that point, they could feel the pain down in the side of the knee. So the key is then, in acupuncture, and as you know it, And in trigger point therapy, the problem is not always where the pain is. The pain is very often remote from where the tension is. That's why it becomes hard to find which points to use. How do I find the right point for the right condition, since there are so many points and there's so many pathways? And this is just talking about the meridians. As you know, there is 12 main meridians. They're all named after the organs. And the main meridians is one of them. And the main meridians have the listed points. They all have the set anatomical location. And then each main meridian has a muscle meridian. And the muscle meridian basically follow the pathway of the main meridian, but not completely. All of those things you could see if you go on my website to all those illustrations. You could go and click on a place, you could see them exactly later. But unfortunately, this is not clear. If you could see the colors here, you could see in red the muscles. So what this is colored in is all the muscles that is related to each muscle meridian, which is pretty fascinating. Because if I now know how to test the muscles, and I could find where this muscle contraction or tension or weakness, and if I know which range of motions that is limited, and if I know if one person have a shoulder is like this, and I know that the upper trapezius is what pulled the shoulder up, I now know what muscle meridians that goes to the upper trapezius. Do you follow me? And so the interesting thing with this is that the muscle meridians is not the actual muscles and tendons and ligaments. It's rather the currency that flow through them. And the trigger points are in those muscles, and they refer pain along those muscle meridians. And every single muscle is related to one or more muscle meridians. And this is why Travell didn't know about it. Because some of the muscle meridians, they overlap. For example, the scalene muscle, which is a deep muscle in the neck here, is related to the large intestine, the stomach, and the small intestine muscle meridian. The pain pattern from the scalenes are in here, which happen to be along the stomach meridian, down in here and into the thumb and index finger, which happen to be the large intestine meridian, and into between the shoulder blades in here, which the large intestine muscle meridian goes into the upper and mid trapezius as well. And the small intestine, which goes in the back of the arm, into the middle of the shoulder blade, and into the scalene muscle. So therefore, when the trigger point, the scalene trigger point is active, it's either large intestine, small intestine, or stomach muscle meridian. And depending on where the pain radiates is which one of the meridians it is. Do you guys follow me? So this is what's so fascinating, because in HMT, and if you go on the website and you click on healthcare providers or students, you could go click on HMT booklet, and on there you could go and see all those muscle meridians. And when you study HMT, you will also be able to know exactly which muscle is related to each muscle meridian. And this is what's so interesting, because if we now bring in the Western sports medicine, physical therapy, athletic trainer, chiropractors, and bring in the concept of range of motion, posture, and muscle testing, I could find out exactly which muscles that doesn't work. And now I could figure out which muscle meridian goes to those, and I could release points remote from this muscle that now could get this muscle to either relax or contract. And I could make immediate changes. So, so all of this is stuff that you know about already. What acupuncture today is recognized by the World Health Organization. It's treated for many, many things, but most commonly treatment for pain, musculoskeletal, neurological problems, headaches, neck pain, back pain, asthma, sinusitis, respiratory conditions, digestive problems, colitis, gastritis, addictions of alcohol, cigarettes, and other drugs, female problems, many other things. It's also used for anesthesia, and as you know, sometimes in China they do surgery with no anesthesia other than acupuncture. And so Western medicine have come to realize that acupuncture perhaps is releasing endorphins and that causes this anesthetic ability. But that's about as far as they're going. So the problem, of course, today in acupuncture, and you know this, is how does the acupuncturist find the points on each visit to create the result? And as you know, not all acupuncturists are equal. Some are better than others. Some are better for some conditions, some are better for other conditions. And so, of course, the goal for you, I assume, as well as for me, is how can I find the right points for the right person? How could I be correct more often? How could I make immediate changes? If it's anxiety, how could I find where the tension is? How could I teach them what to do? If it's shoulder pain or neck pain, how could I release it and get them to move their neck? If it's headache, how could I get the headache go away and teach them what's causing the headache? If it's back pain or knee pain, how could I get the pain go away, the range of motion improve, and teach them what they need to do? So, and this is what's perhaps interesting for people on the other side of the spectrum when I have physical therapists and chiropractors. Of course, what does Western science think about acupuncture? And I mean, you as well as me, in the beginning, when you come out and you talk to regular doctors, I'm sure you met all the stereotypes on what they think about it. But scientists in the Western science have not been willing to accept the existence of acupuncture points and meridians because they're not physical in nature. They can't find them, they can't see them. So acupuncture, in essence, is another form of communicative system in the body other than the nerve system, the blood circulation, and the lymph circulation. And they haven't fully accepted that. Research have, however, found that there's a change in electrical resistance and temperature can be found on the surface of the body at the site of a hypersensitive spot. This is interesting. You could see this picture here. This is a thermogram. And of course, you could realize that this is pretty much a hot spot right here. Looks almost like a weather camera or something like that. So either through thermograms, which measure the temperature radiating from the body, or what's called an ohm meter, which measures the electrical resistance, and you've probably seen they're called point finders, or Kirlian photography, can you see those changes in electrical resistance, the buildup of tension or temperature? So the points are there, but what made it hard for scientists to fully believe in this is, well, I could see this on this person, but I don't see it on this person, and I don't see it on this person. On this person, I see another spot. But that makes perfect sense, doesn't it? Because it's only going to show the circuit breakers that are blown out. And it's going to be different points in different people. It might even change hour by hour. If they go out and have a bad lunch, it might be another spot. If they get a call with a stressful message, another point might show up. It changes all the time. So where is trigger points in physical therapy today? Well, it's used all over the world. It's used by chiropractors, physical therapists, athletic trainers, body workers. Of course, the problem is finding the right trigger points. Most of the time, people just poke around. Oh, and the person, oh, that's the spot. They just stumble over it. But they have no way of figuring out, oh, where is the trigger point? And when they find the spot and they rub it and it causes pain into their head, and they say, it's interesting. This is giving me the headache, they say. And they're trying to release this tension. But they don't have a way of following the whole pathway and see if there are other blockages. And they don't have a way of understanding the cause of these reflex points. Or if there are other reflex points on the same chain that they need to release. So the problem in physical therapy and trigger point therapy is very often that they more or less stumble on points, find them, work on them, but they don't know how to tell the person what caused it, and they're not sure that they found all of them or released them completely. But it is used extensively. So that comes back to HMT then being a bridge between East and West, because really what we're doing is we're bringing together those two techniques, and we're using a Western approach of determining muscular imbalance to find which points to use. So what makes this so revolutionary, this is a whole new set of selecting points that does not have to do with the pulse or the tongue. It's just measuring tension in the body and finding where that tension is. So the key thing in HMT then is muscular imbalance. That's the whole thing. How do I determine that? A balanced muscle is able to fully contract as fully lengthen. In anatomy, there's synergists and there's antagonists. For example, when I bend my elbow like this, I use my biceps muscle, my brachialis muscle, my brachioradialis muscle, and I'm bending the elbow. When I straighten the elbow, I use the three heads of the triceps and the anconeus muscle. The biceps, the brachialis, and the brachioradialis are all synergists. They do the same thing. They bend the elbow. The triceps, the anconeus are all synergists. They straighten the elbow. The triceps is an antagonist to the biceps. The biceps is an antagonist to the triceps. There needs to be a balance between those two so that the scale is level. Do you follow me? Now, if one is stronger than the other, then I either my elbow is bent all the time, or my elbow is too straight, and I can't bend it. So, a balanced muscle is able to oppose its antagonist without overpowering it. When I eat and I bring food to my mouth, I'm contracting my biceps muscle to bring the food to my mouth. But at the same time, the triceps muscle is breaking the motion, so it's a harmonious one. Then when I bring the fork down to the plate again, my triceps muscle is straightening my arm and the biceps muscle. If they didn't work, I'll be throwing food in my face or so. So there has to be a balance between those. This is a yin and yang. You guys see what I'm saying? Here's the yin muscles, here's the yang muscles. Here's the yang meridians, here's the yin meridians. There has to be a balance, and whenever there isn't a balance, we have a problem. If the person can't straighten the arm all the way, it means there's too much tension in the muscles that bend the arm. If the person can't extend the arm all the way, if the person can't bend it all the way, then it means there's too much tension in the back. So if I know what's normal range of motion, 150 degrees of flexion, if I know what normal extension is, 0 degrees. If they can't straighten all the way, it means there's too much tension here. If they can't bend all the way, it means there's too much tension here. You guys follow me? So, a balanced muscle is able to oppose its antagonist without overpowering it. I don't want to throw food in my face. I want to be able to do this. It's like a symphony that every instrument has to play at the right time in tune with others, and stop playing and start playing at the right time. And whenever it's not right, it's not going to be beautiful music anymore. So an imbalanced muscle is either shortened, hypertonic, or elongated, hypotonic. So this here illustrates two muscles that is out of balance. Can you see what I'm saying? One is contracted, pulling too much. One is elongated, not pulling too much. Which one is yang?
Contracted one.
Exactly. Which one holds too much tension?
Stretched one.
No, the contracted one has more tension because it's so contracted. The other one is elongated. There is stress in both muscles. But one there is stress because of too much contraction. The other one there is stress because it's too elongated. Now, needless to say now, this means in this case there will be either acupuncture points or ashi points in this muscle that I could release that will cause it to lengthen. The question is, of course, is the short muscle contracted because of lack of opposition of the long muscle, or is the long muscle long because of too much contraction in the short muscle? What came first, the chicken or the egg? Well, you could go back and forth on that as much long as you want to. But in HMT, what we're focusing on is finding the contracted one and releasing them. And when we do that, then we're able to get that joint to function again. How is this practical? Well, Kirby is a good example. When he came in to me the first time, he was all bent over coming in with a cane. So needless to say then, there's muscle that's too contracted because he couldn't straighten up his spine. You follow what I'm saying? Now, if I could figure out exactly which muscles are contracted, and I could find where on that muscle meridians that ashi points are, or acupuncture points are, if I could release them, then that muscle is relaxing. When that muscle is relaxing, what happened then? It lengthens. When it lengthens, he's able to straighten up. So, what happens when you have this imbalance? When one is too contracted and one is too elongated? Because this is the whole essence of HMT. If I could go in through posture, range of motion, and muscle testing and find exactly where is the tension, I'll now have a new way of finding meridians and points to work on, which I'm going to show you step by step. So when I have muscular imbalance and muscle shortening, this muscle is shortened, and you could see this muscle is shortened because what is it doing to the bone? It's pulling the bone this way. Can you see that? So let's say if I have a too short upper trapezius, it pulls my shoulder up. One very common thing is if everyone stand up right now, it'd be good to get your chi moving. Stand up and let your arms hang by your side. Okay, and I'm going to pick on one of you. You guys don't know what I'm looking at. And I'm going to have you just come up. So I'm going to pick on you. Come on up. A bunch of you have it, but I just want to pick on one case where it's, and I want you to stand facing the class. And I want you to have your arms relaxed. Okay, so what you could see on his hands compared to my hands, what's the difference? His arms are turned in. What does that mean? That means the muscles that internally rotate the shoulder are too contracted versus the muscles that externally rotate the shoulder. So in this case, it means the pectoralis major, the latissimus dorsi, the teres major, the subscapularis, the anterior deltoid. Now these are things that you're not that familiar with. But the nice thing in HMT, you don't even have to memorize all those muscles that do this, because I've come up with a software program. You only have to learn to see if his arms are turned in or not. So all you have to do is to click his arms are turned in, and now it's going to tell me exactly which meridians are affected by this. So in other words, which ones are the muscle meridians that goes to pectoralis major? It's going to be the stomach. We talk about the muscle meridians now. But it's also going to be the pericardium, the lung, the heart, causing internal rotation. Which muscles go to the subscapularis, which happen to be a muscle in the armpit underneath here? The heart. Which muscles go to the anterior deltoid? Which muscle meridians? It'll be the lung and the pericardium. You guys follow what I'm saying? Which muscles go to the latissimus dorsi? So the latissimus dorsi are muscles in the back here, but it actually attaches here, so when it contracts, it can turn in like this. It happened to be the small intestine. The spleen meridian goes there, the gallbladder, and the bladder. And so now, when I have established, let's say, for example, that he had a shoulder problem. Okay, let's say that he had a limited range of motion. Let's see how this goes. Tell me if any of this causes any discomfort, okay? Relax. Let's see if I could turn. Can you turn your hand all the way so you touch your mouth? Okay, so this is a positive test for the subscapularis. You should be able to touch your mouth when you do this. When you can't do this, it means the subscapularis is too tight, okay? So subscapularis is one of the muscles that internally rotate the shoulder, okay? Now, then there's a test for the pectoralis. And so if you come and you lay on this table right here, lay with you on your back with your head this way. So the test for the pectoralis.
Everybody should probably get up and come over.
Yeah. Let me move this down here too. So I want you to scoot into the middle of the table. Okay. So this here is a test for the pectoralis. Okay. So he can actually do it. This is another test for the subscapularis. So let's lay on this hip and shoulder. Bring both knees up to your stomach. Okay.
That's a little bit of impingement on that right there.
Right there. So this here will be the pectoralis. Okay. And how about that? Any impingement there?
No.
Okay. Okay. So right now the pectoralis major and the subscapularis from those muscle length tests and from observing his posture. Okay. So I determine it by looking at how he stood with his hands. By two, see here how this arm is not dropping all the way down. And in this position, you could see too, he's feeling a little bit discomfort, and the arm is not coming all the way to touch here. So that means that muscle is short. Okay. And three, he couldn't wrap around and touch here, which is subscapularis too. Okay. Good. Stand up, please. So then I could now test those muscles. So push that way. I'm testing the pectoralis major sternal. Then I stretch the pectoralis major sternal, and then push that way. Okay, so let's do this again. Okay, push hard against me, relax, stretch it, and push hard against me. What happened the second time?
Yeah, weak.
Yeah, so when a muscle weakens after it's stretched, it means it's too contracted because it doesn't like to be stretched. So I know the pectoralis major is too contracted from a number of things. His arm is turned in. When he lay on this side, his arm can't drop down. He feels a little bit of impingement in the shoulder. And then we could test the subscapularis. So push back here. Relax. Stretch it. And push back. Same thing. Okay. So let's do it again. Push back. And then when you do, you stretch it. And push back. Okay. So the subscapularis and the pectoralis major are two muscles that are shortened in here. Let's pull in here, test the latissimus dorsi. Okay. Push in hard. He's okay there. All right. So now then, we determine both by muscle testing, by posture, and by range of motion that he has shortness or contraction in his pectoralis major sternal and his subscapularis. Okay? So so we're going to bring you back in a little bit when we move on. So this will be a good example. Okay? So if everyone take a seat again. Are you guys following me so far?
Yeah.
Okay.
Are you
so
going to show us how you release it?
yeah. So what happens when a muscle is short? It causes decreased range of motion, lack of flexibility, which we saw when he laid on his side. The arm wouldn't drop down, and which we saw on this, he couldn't go all the way around. Okay? Then poor posture, change positions with decreased joint space. So in other words, because the posture is, when he stands like this, that's poor posture. Now, everyone has poor posture because I could find a posture fault in every single one of you. But What that means is when his arms are turned in like that, it changes the space in his joint. Now, depending if you would have been physical therapist, what I'm going to say to you now would have made more sense. When the arm goes into full flexion or abduction or extension, it has to externally rotate. It has to turn back, because the shoulder joint is a ball and socket joint, and it has an overhang by the collarbone and the acromion coming from the shoulder blade. And so it's kind of like a ball and socket joint with a garage overhang here. And when you are fully lifting your arm up in flexion, in abduction, or this extension, then the shoulder has to externally rotate so that two bony knobs on the humerus could clear underneath this overhang. Now, if the arm is too internally rotated, it's now hard in certain positions. You might feel an impingement. So the test I did when he laid on his side and I had him drop down and lift the arm, he could feel a little bit of impingement because that muscle was too tight. And it internally rotated shoulder, which didn't allow for that clearance to take place completely. Do you guys follow me? So he could potentially have a shoulder problem. If he doesn't have one, he could be at risk at getting one. If he did, for example, a lot of push-ups or bench press, or if he lifted something where he had to use those muscles, he might then feel some pain in the front of the shoulder. So either he could have the problem or he had risk at getting the problem. You guys follow me? Okay. So the posture changes the position of the joint and decreases the space in the joint because he can't fully extend, rotate because it pinches there. Do you guys follow me? If the shoulder would have been in this position, he could have laid the arm down effortless. So decreased joint space, and what happens if a person have decreased joint space for many years? It's going to cause degenerative condition and arthritis. Okay? So what else does it do? It decreased the strength and endurance, and we saw that on the muscle test. When I stretched the muscle, which lengthened it, and tested it right after, both the pectoralis major and the subscapularis, it weakened. Decreased vascular circulation and an oxygen deprivation in there. Inhibited lymphatic drainage. Nerve compression, friction leading to neuropathy, nerve dysfunction, and radiating pain. Pain and inflammation. Do you have any numbness or tingling in your arm, or wake up with your arm numb or anything like that? No? Have you had any pain in the shoulder? No. Okay, that's good. So then we just caught attention before it's actually an injury. All right? Muscular imbalance. Muscular imbalance is present where the human body holds its tension. The key is, of course, to find where do they hold their tension. Now, by observing all of you, there was a number of you who had this. This was just one observation. There are many tests, and every observation and every test tells you if there's tension in a certain area or not. So, tension in skeletal muscles is detected through feedback, and the feedback is called muscular imbalance, and this is done by range of motion, posture, or manual muscle testing, like I just showed you. Okay, come back to this in a little bit. Okay. Good. Is there anyone in here who has a shoulder problem or shoulder pain? You do? Okay, why don't you come up to? Which shoulder is it? Okay. How long have you had problems with it?
For a while.
Okay, and what hurts with it?
It's mostly tension here.
Up in here?
Yeah.
Okay. And does it hurt all the time or only when you do
No,
certain things?
I have numbness in the morning.
Okay. So first of all, you could see she has the same thing with the arm turned in, because a completely balanced position, the thumb should point forward. Okay. And if I look at her, she's a little bit better now. But you turn sideways here. Now see what when I put my hand here on her shoulder blade. See the angle of my hand here. That should be sitting like this. So you could see how her shoulder is tilted forward, and you could see how this portion here is too much forward. It should be more back like that. So it means her shoulder is anterior, her shoulder blade is tilted forward, and her arm is turned in. She experienced pain here, and she has numbness in the arm. When is the numbness? In the mornings when you wake up? Okay, good. So then we could look into the neck. Any discomfort or pain there?
Impingement right there.
Where do you feel it, the impingement? So she feel discomfort there. How about when we come this way? Any pain there?
No.
Okay. How about when I turn this way? Any pain here?
Pulling a little bit in that same area.
How about here?
No.
Okay. How about here?
No.
Okay, good. Give me. How about if we go forward like this? Any pain or discomfort there?
Where your hands are?
No, in your neck.
There's tension on this.
Okay. So here you could see too, her chin should be able to go all the way down to here. So that means she has tightness in the muscles in the back of her neck here. Is this where you feel it in here?
Yeah.
Okay. And when we do this, she could feel the tension here. Okay. And you could see how much further she could go this way than she could go that way. Can you see that? So that means she has tension in the upper trapezius, and she has tension in the neck extensor muscles. Yeah?
Her whole shoulder raised when you tilted it to the...
Yeah, yeah. So what is that telling you? That the muscle that goes from here to here is too short, so it lifts up. She's trying to cheat by that. So it tells me a lot. There's a lot of tension in that muscle in the upper trapezius for two reasons. That was a very good observation. The fact that not only does she limit, and she could tell me to feel tension there, but that shoulder lifts up because the muscle is so short. Okay? Good. So now let's lay on the table here, on your back. Okay? So then I'll do the same test I did before. That's okay. Now lay on this hip and shoulder and rotate this back. So she feels impingement here too. That's okay there. But when I go through that arc here, you don't really like it when I come in there somewhere. Is that right?
Yeah.
Okay, good. Turn over to your stomach, please. Okay. Relax. Good. Good. Sit up with your back towards me, facing the class. Okay. Give me both of your arms. Turn them around like this. Push up hard. Okay. Now turn your head to the right as much as you can. Lean your head back as much as you can. And push up. Turn your head to the left as much as you can and lean your head back and push up. Turn to the right as much as you can, lean your head back and push up. Do you feel the difference?
Yeah.
Okay. That's called a cervical impingement test. When she turns her head to that side, she pinches off that one. That means that there is some compression of the nerve when she turns here, which be either of the scalenes or the neck extensor muscles. We already know her neck extensor muscles are tight because she can't come all the way forward here. We already know she has a limitation here, which is the upper trapezius, but that could also be the scalenes. So we know now neck impingement, possible tension in the scalenes, possible tension in the upper trapezius, tension in the neck extensors. All of this we found out from just doing those tests. Okay. Now, let's just do a couple of real quick tests. Let's give me your arm here. Keep your arm like this and push back against me. Push back. Push back. Okay. So this is a test of the lower trapezius. When the muscle is weak right away, it means it's hypotonic, meaning it's elongated. Push back here. Now that means I don't want to work on that muscle because the tension is in the opposite muscle that is contracted. So now I could use applied kinesiology and do something that's called therapy localization. I could touch and see if touching a certain area will make her stronger. So I could touch in here, push back against me. I could touch here, push back against me. And I could touch here, push back against me. So it told me when I touched here and I touched there, she gets stronger. Why is that? Because those are the antagonists to that muscle. Do you guys follow me? That means in this case that the upper trapezius, that is an antagonist to the lower trapezius, one lift the shoulder up, one pull it down. The lower trapezius also pull the shoulder blade back and down, and it's obviously weak because her shoulder is like that. So that one is elongated, but there's tightness in here, and the other one I tested is the pectoralis minor. The pectoralis minor is what pulled the shoulder that way. Now the pectoralis minor also go through where the brachial plexa come through here. So if she has tightness in her scalens and her pectoralis minor, it's going to compress the brachial plexa, which is going to cause numbness in her arm and hand. So then I could test the upper trapezius, push hard against me. And then I could stretch the upper trapezius, and then I could test it again, push hard. So that means that one is too tight or hypertonic. Do you follow me? Then I could test the pectoralis minor. Keep your arm like this, push hard against me, I'm pushing back and up. And then I could stretch the muscle here and push. So I have a pectoralis minor that is too tight. I have an upper trapezius that is too tight. I have a lower trapezius that is elongated. I have a limited range of motion to that side. Even the shoulder comes up when I do it. I have a person complaining of pain and tension here. And then I have the impingement test. When she turns to that side, she weakens, which also will explain the numbness there. So lay on your back, please. Then I could test the scalens. Push up hard. Contract, stretch, push up. Did you try hard a second time?
Sorry,
too?
I'm pushing.
Okay, so push up hard, relax, stretch, push up hard. Yeah. Push up hard, relax, stretch, push up hard. Let's do this one again. Push up, relax, stretch, push up hard. Yeah. So you notice the difference on the two sides? Mm-hmm. So the scalens is too contracted, the upper trapezius is too contracted, and the pectoralis minor is too contracted. You guys follow me? Now here's another test. This is a test for the pectoralis minor. Now it's hard to see on black, but if I put my fingers on top of her shoulders, do you see the difference on the two shoulders here? Can you see how the right one is higher? And if I put my hand here, it's like a little bit of a gap here. On this side, it's not as noticeable. So there's more gap here, meaning this is pulled forward more. So that's the pectoralis minor. So she has a positive pectoralis minor test. She has a positive cervical impingement test. She has a possible limited flexion to the left. She has a positive limited flexion forward. She has a hypertonic pectoralis minor, a hypertonic upper trapezius, and a hypertonic scalens. You guys follow me on all that? And she complains of pain here. Do you get headaches?
No.
Okay. So there is no headaches, but there is numbness in the arm and hand. And when you said mostly in the mornings?
Mostly in the mornings, and I've noticed that I tend to drop things.
So in both hands you drop things?
More often in this hand.
Yeah, because the right was clearly worse. Okay, so now, if you go back, all of you guys go back to your positions again. So now, I just hooked those up to the HMT software, because how are you supposed to remember every muscle that do everything? I mean, you could imagine all the different combinations of muscles that are involved here. But you could learn to see those tests. You could all see that she couldn't bring her head to that side as easy. And you could check the box for that. You could all see she couldn't bring her head all the way down, and you could all check the box for that. You could see when she laid on her back that her shoulder, that shoulder was higher up. Could check the box for that. You could see when she stood that her shoulder blade was tilted forward like that. You could check the box for that. You, at this point, don't know how to do the muscle testing, but two of you do. You could test the pectoralis minor and stretch it and see if it weakens. You could test the lower trapezius and see if it's weak. You could test the upper trapezius and stretch it, see if it weakens. And you could test the scalenes and stretch them and see if it weakens. Now, of course, that's things that the other ones of you could learn. But all of you could see those things, and all of you could see that that's a limitation. And she has those things. Now, on the HMT software, and again, I apologize for this not being so dark here. I'm going to click on here. So in the software, this is online. So people that take the class or other people could actually subscribe to this, and everyone who take the class get to use this software. But in this software now, you have all the different things: postural evaluation, range of motion evaluation, and manual muscle testing. Now, at this point, only 2 of you know how to do the manual muscle testing, but all of you could see those quick range of motion tests I did. And if you were just looking over a form and you memorize it, all of you could do those and check a box for the things we found. The final thing we have here is pain zone mapping. So I want you to understand what this means. For each and every postural imbalance, there are certain muscles that are contracted and certain muscles that are elongated. That means that the muscles are contracted have muscle meridians that are blocked. And there are trigger points or points in those muscle meridians. Do you guys follow me? Now, for every range of motion limitation, the fact that she couldn't bring her head all the way over to the left or couldn't tuck her head all the way forward means that there's some muscles that are contracted, which means there's some muscle meridians that have tension in it with trigger points in it. For the muscle testing, for the muscles that were strong, but then they were stretched, weakened, mean that they have too much tension in them. It means that they are related to muscle meridians and trigger points. You guys follow me? So the final thing we have here is pain zone mapping. So this software then takes into consideration what postural problem, what range of motion problem, what muscle testing, once you learn that, is where's the tension. And then it takes the pain zone, and this is something that all of you guys could do, because let's say that she has pain in the neck and head, okay? So if I go on this one here and click on that, so what her pain is in the actually, this would not be a good one, but let me just show this anyway. Let's say, for example, that let's say she had vertex headaches. Let's say she had pain on the top of her head, okay? And then I run the report. Then the software will tell me which muscles have trigger points in them that cause pain on top of the head. So the muscles that would do that, for example, is sternocleidomastoid. And you could see here the trigger points for sternocleidomastoid could cause pain on top of the head. Now this happened to be on the stomach and large intestine meridian. You guys follow me? So I now could either go in and treat those trigger points if she complained of headaches there. So I could use the pain, wherever the pain is, to determine which muscles and which ashi points to work on. Or I could use wherever the pain is to determine which meridians, because the meridians that goes there was, I said, stomach, large intestine, but also gallbladder goes into the sternocleidomastoid, because the other muscle that is related to is the neck extensors. See how that one could cause pain in the head. And the neck extensor is related to gallbladder and bladder. So now if I go back to here, I now have a choice to work on the gallbladder. 2 of the muscles indicated gallbladder, because both the sternocleidomastoid and the neck extensors is part of the gallbladder muscle meridian. Or I could go to the large intestine, the small intestine, the stomach, the triple wormer, and the bladder. And I could, with muscle testing, very quickly determine which meridian I should work on. And let's say that in this case, I went to the gallbladder meridian, and that's what was indicated. I could now then see I could see here all the muscles along the gallbladder meridian. And I could go in here and work on, start from the beginning on gallbladder 44 and work up along the gallbladder meridian. And I could test any of those reflex points, Ashi points, along the gallbladder meridian until I come all the way up to upper trapezius, sternocleidomastoid, neck extensors. You guys follow me? So I could either treat just the muscle and the trigger points and Ashi points in the muscle that was indicated, or I could treat the meridian and trigger points and Ashi points in that meridian. Okay? But let's go back to the case we had instead. Instead, I'm going to say that she has torso pain because she had pain in her upper thoracic pain, because the upper trapeze is considered upper thoracic pain, and it was on the right side she had it. And then I run the report, and then I see all the muscles that could cause pain in that area. Upper trapezius, levator scapula, all of those have pain patterns that goes to that area. Okay? But it's very easy now when I do more than one test. See, this is only saying that she has pain in this area. What if I now go in and do the software? This is why I'm going to show you why this becomes so specific. So if I first go in and do, let's do that one first. So she has pain in her upper thoracic on the right. Then I run the next test. I do postural evaluation. And on that, remember her arm was turned in like that. How she stood like that. So that means, oh, let me see here. Okay. Okay. Here we go. So she had the arm was turned medial. Why is that? For some reason I can't. Okay, here. So her arm was turned in. And then we go to the next thing on posture, actually range of motion, upper extremity. She had the spine range of motion. Oops. So she had a limited, if you remember, she had a cervical impingement test on the right. She had a limited lateral bending to the left. And she had limited flexion. She couldn't tuck her head down. Okay. And then we go to the next test. We do the manual muscle testing. She had the upper trapezius on the right was hypertonic. We had the lower trapezius on the right was hypotonic, meaning it was too elongated. And then we had the scalenes on the right was hypertonic, shortened. So these are all the things we had. So I'm just going to repeat it to you guys one more time. Her arms were turned in. She had a limited bending to this side. She had a limited flexion to this side. When we tested the pectoralis minor, after we stretched it, it weakened. When we test her upper trapezius, After we stretched it, it was weakened, so the upper trapezius was short and contracted. The pectoralis minor was short and contracted. We did the scalenes, after we stretched them, they were contracted. When we did the impingement test, she had that. So we had all those things, and all of them shows up here now. Pain in the upper thoracic, the arm turned in, the flexion of the neck limited, the lateral bending of the neck limited, the cervical impingement test positive, the upper trapezius on the right being too tight, the lower trapezius on the right being weak, and the scalenes being too tight. And with all of this now, it just tells me exactly which meridians to work on. So small intestine shows up 22 times, bladder 15 times, large intestine 13 times, gallbladder 12 times. So if you come up here now again, basically by just filling out those tests, I could now go in and muscle test her using this side, push up hard, and I could ask, should I work on the small intestine? So I go to the sink point, which is the end point where the muscle meridian start on the small intestine. I test with the muscle testing, and I didn't get any change. So the muscle is strong, push up hard. I test here, nothing happened. Okay, then, can you take off this shoe? I could go to the sink point of the bladder, which is bladder 67, and test. And I didn't get a result. Then I could go to the sink point of the large intestine, which is large intestine 1, push up. And she weakens. And then I could go to the sink point on the gallbladder, push up. She weakens too. Then I could go to the triple warmer, which has 9 indications, push up hard. So I could just stop there. I now know the large intestine and the gallbladder meridian, the muscle meridian for them. Okay? So now I could work on one or the other. Okay? And so let's just see real quick here. Push up hard. Okay. So I'm going to start with the gallbladder. So if you guys now said that I'm going to work on the gallbladder, so I could now go in and look at gallbladder muscle meridian, and I could scan along the gallbladder meridian. So if you lay down, and you guys could all come up. Yeah, take the other shoe off there. So now I have the muscle testing still as my tool. I've determined I'm going to work on the large intestine and gallbladder meridian. And I'm pushing here. And then I get a reading on there. Now I start scanning the gallbladder meridian and testing her arm at the same time as I'm. So there's a point here. You guys all know what that is. And there's something in here. Push up. Something in here. Something in here. Oh, that's strong there. Okay. Push up. No. And I could do large intestine. Push hard. Feel that? Mm-hmm. Okay. Push hard. Okay. So the interesting thing is push up hard. Push hard. Push hard. So large intestine show up large intestine 4 and some points up here in the scalenes. Gallbladder shows up points here, probably gallbladder 31 or something. Gallbladder points around the hip, in the pectoralis minor area, in the upper trapezius. So that's how fast I did that. Now I'm just going to release some points, and I'm going to show you how those things that we found goes away. And if I find the right points, she's going to feel referred pain the same areas where she has her pain. Because I should be able to reproduce that pain that she has when she gets her numbness and her pain in her shoulder blade. So push up hard. Push up, Paul. Okay. Lay on this hip and shoulder, please. So I'm going to stand on this side so you guys could see better. Push up, Paul. So gallbladder in Chinese medicine is related to decision making. It's related to the spring. It's relating to starting. But it's also related to setting boundaries and speaking up and being decisive. Now, do you have a hard time saying no?
I used to, and sometimes, yeah.
Okay. And so do you find yourself do things that you don't want to do?
Sometimes, yeah.
Okay. Do you have any problems with greasy, oily food? Does it agree with you or not agree with you? Do you like it or it doesn't agree with you? What happens when you eat greasy or oily rich food?
I usually have to use the restroom pretty quickly.
Okay, so
I feel like
you get loose bowel movement.
Yeah.
You got to go. Okay. Do you get bloated or feel full or anything like that?
yeah.
Okay. Okay. Do you have a hard time making decisions, or
I'd say it takes me a while to make like big decisions.
Mhm.
Like, I can make simple ones, but big
Can-
ones take me a while.
can you feel how this point is loosen up?
Yeah.
Push up hard. So here's the next one. So how do you deal with anger? Do you hold it in or you let it out? Can you feel this one? Can you feel this one going into your...
Hold it in. Ooh.
You hold it in, yeah. Can you feel this radiating into your butt or into your leg when I do this? Just breathe, just breathe. You could relax your arm, yes. Deep breathing. Can you feel it anywhere else than where I'm doing it?
It's kind of going to my butt now.
Yeah. So when I hit a trigger point or archie point that is active, I will have some form of referral. So if she finds herself sometimes having a hard time saying no, and maybe more so in the past than now, then she found herself doing things she doesn't want to do. And if she found herself having a hard time to make some decisions, other people could maybe rush her sometimes to do things. And she go along and do things. And when you do things you don't want to do, how do you feel? Angry and resentful. And when you get angry and resentful and you don't show it, what do? You suppress it. And when you suppress anger and resentment over doing things you don't want to do, or not being clear on what you want to do, or maybe even being frustrated with yourself for not being clear on what you want to do, or maybe not being able to speak up or set a boundary with someone, or maybe a person in particular. Can you feel that loosen up?
Oh, yeah.
Is the pain gone?
Yes.
Okay. So I could feel how the tension goes away completely. And the thing that makes this a little harder now, in healing, it's very, so there's another one right next to it right here. So the way I could see strong, and I scan along the gallbladder muscle meridian, along all the muscles, because the tensor fasciolata, the vastus lateralis, the gluteus medius, the gluteus minimus, the gluteus maximus, they're all gallbladder meridian. So there's another one right here. Now, the purpose of this right now is to educate you, so that means I'm not as present with her. But in healing, it's very important to be present with the person you're working on. But the reason I'm talking about the things I'm talking about, because the tension in the point gets worse. Is there any one person you have a hard time setting boundaries, or is there any one decision you've had a hard time making lately? Or is there anything that you're doing that you don't want to do that you're doing lately?
I feel like I've been able to set boundaries with most people, but I have one person I still
Okay.
struggle with.
So can you think about that person as I'm releasing this pointer?
Okay.
Think about what is in particular that you have a hard time setting boundaries with. Can you feel that spot? Can you feel it radiate?
Yeah.
Where does it go?
I feel like it stays kind of local.
Okay.
Going towards the gluteus a little bit.
Okay. And just think about that person that you still have some problems with boundaries. Can you feel that loosen up?
Yeah.
Push up on. Yeah.
So, if the
Lay on your back.
psychosomatic issue is the underpinning for this pain,
Mm-hmm.
like most often it is,
Mhm.
psychosomatic,
Mm-hmm.
your technique
When we are talking about a pattern that she repeats, obviously she's worked a lot on herself. And this obviously was a much bigger problem before, I assume.
Oh yeah.
And so she has come a long way. But she still has one person in particular where she repeats the same pattern when she has a hard time setting boundaries, a hard time speaking up, and perhaps goes along and do things she doesn't want to do. Okay? And so repeating that pattern and continue to be frustrated and irritated with doing things she doesn't want to do and not being able to speak up for what she needs and what her boundary is causing frustration, irritation, and anger. Okay? And so when I'm talking about the same things at the same time as I'm releasing the tension, I could literally feel when I work on the point, when she starts thinking about that guy, I could feel how the points get tighter.
How'd you know it was a guy?
Well, actually, I guess I didn't. But a lot of it, was it a guy?
Yeah.
Okay. So maybe this is mostly guys in the past. You know, maybe that's a pattern, and so push apart. So now I'm on the pectoralis minor, which the gallbladder muscle meridian comes up for her. But pectoralis minor, and the trigger point for it happened to be right at lung 1. And so lung also then. So the pectoralis minor here is one of the muscles that pulled her shoulder forward. And you're going to feel this shooting into your shoulder and into your arm and hand. Can you feel that?
Yep.
Okay. So when the lungs are involved, where the lungs is the metal element, in my book it's the fall, then very often the person might want to... Start crying, yeah. They might want to please all the time. And so they do things they don't want to do because they want to please. And so when she does things she doesn't want to do because she wants to please, then she tense up here. Can you feel that? Yeah. Do you feel it down in your arm?
Yeah.
How far down?
I feel like I can feel it. My fingers now.
So do you see how I'm recreating this chi? She could actually feel this sensation into her hand and arm, which is part of the symptom she was complaining of. So it's quite possible that the tension in the pectoralis minor, which pulls the shoulder forward and down, has to do with this self-esteem issue that she has to please someone. Or maybe that, she's trying to do things she doesn't want to do because she wants this guy to like her. And maybe that's a pattern that she's done in the past and she repeated, so it has a lot of tension with it. Can you feel that loosen up? Okay. The pain is gone, isn't it?
Yeah, for the most part.
Push up off. Okay. And so very often then, since this also happened to be on the lung alarm point, the lungs is the organ that's supposed to receive, let go, and move on. Breathe in and breathe out. And so it has to be a balance between receiving and giving. And so if a person, for example, is giving more than they're receiving, and they do things they don't want to do, then they're going to be frustrated and they don't set a boundary. And now they're going to have some resentment and irritation about that. Is that something that happened with you with guys in the past?
Yes.
So you guys see how the points tell me a story about where the points are related to, which organs they're related to, what tension it is. And I'm basically asking and telling her what they're related to, and when she then starts thinking about those things. But obviously she's worked a lot on herself and she's been aware of this pattern, and she corrected this pattern, she said, with everyone except for one person, okay, at this point.
Yeah.
But you don't want to have this pattern anymore with him or with anyone else.
Exactly.
There you go. Feel that loosen up?
Yeah.
Okay, good. Now, I want you to sit up, please. Remember, the final point we find was in the upper trapezius, which what gallbladder point is it that we have up here?
21.
Yeah, so either gallbladder 21 or trigger points, ashi points. So now I'm hitting this spot, and I want you to lean your head from this side to this side. Lean your head all the way to the left, all the way to the right. And now you might feel pain shooting either into your neck or into your head. Can you feel that?
Yeah.
Okay. Where does it go?
I feel like it's shooting more towards my neck.
Yeah, okay. So lean your head from side to side. Do you, so in a relationship, well, I'll probably come to that when I come to large intestine. I'm just thinking because what I got into the lung right there. Can you guys see how she's relaxing more and more in her face? Can you also see how the head is moving easier and easier over to the side? So the connection with releasing the point, recreating symptoms where her pain is, meaning I'm on the right spots that's causing this tension, and then talking about things that could potentially be the reason why she has tension in those areas. Because if she has this pattern in the past where she tried to please and she didn't know how to say no, and she did things she didn't want to do, and she was giving more than she was receiving, and she got resentful, and then she feel maybe taken advantage of, and then part of that come to why is it that she wants to please so much. Very many people who are in healthcare field are very much givers. And you have to watch that balance because you have to be able to receive too. Can you feel that loosen up? There you go. Okay, now lean your head over to the side. Can you guys see how much further her head could go? Any pain when we do that?
No.
Good. So now I want to come up here, push up hard because she had push up. Because she had such limited flexion. So this is higher up in the gallbladder, closer to gallbladder 20. Woo. Tuck your chin all the way forward. So I'm using the same pressure the whole time. You could tell on her, oh my God, is he killing me? What the heck is he doing? But she's now, because this is about the 6th point, she figured out, well, after a while it releases, okay? So relax your head, move your head back and forth, all the way forward. And so this suppression of anger over not having her needs met, of feeling she give more than she receive, of taken advantage of because she is kind, has been hurting her in relationships. And another person might take advantage of her. So it's very often this person become resentful and angry and feel taken advantage of. But also she allowed this person to do that and kind of trained them by not saying no from the beginning. And the reason she didn't say no was because she wanted to please, and maybe in the past she didn't feel good enough about herself. And again, only if it fits do you take it on. I'm just telling the stories that are sometimes happening. Okay? Because these are patterns. Do you understand? I'm talking about patterns from the law of the 5 elements. The patterns of dysfunction. It's all, in Chinese medicine, it's all about Qi and Lin. Lin is patterns. Patterns of dysfunction and patterns of function. Can you feel that loosen up? Head all the way forward. Can you guys see how she's going further? Almost all the way down. Okay, so now let's do large intestine. And interesting, we got, push up hard, large intestine 4 showed up. As you know, that's one of the most powerful points there is. But I'm looking at large, I'm sorry, we're going over a little bit. Yeah. Yeah, thank you so much for coming. Can you make sure if you either are interested that you either contact us so we get your email address, or you give Sharon your email address, one or the two, so we could contact you?
Absolutely.
Okay. Yeah. So large intestine in Chinese medicine is the organ that accepts the outcome, let go and move on. And if it doesn't accept, then you either hold on, which is constipation, or you let go, which is loose bowel movement or diarrhea. But a person could be mentally, emotionally constipated or have mental, emotional diarrhea. Mental, emotional diarrhea is the one that doesn't give a shit anymore. Okay? And mental, emotional constipation is when you hold grudges, when you hold in the anger. So I want you to think about, in this point, the relationships you had in the past when you felt like you were taken advantage of. And can you feel that spot?
Yes.
And do you feel that radiating either into your index, thumb, or little finger, or up in your forearm?
Forearm.
Okay. And I'm working. See, here's another thing that I didn't tell you. When I work on the spot, I actually test in which direction to apply the pressure. And I'm applying the pressure based on 5 different directions, based on the law of the 5 elements. I'm actually applying pressure on large intestine 4 in the direction of the spring element, or earth, or wood. And wood is anger, frustration. So holding on to anger, frustration, or resentment, because she got her feelings hurt. Can you feel that loosen up?
Yeah.
Good. Give me that hand. Push up hard. Good. So then, push up hard. Coming up in here. Remember the scalene muscles? Right here. This one here, you might feel this shooting down in your arm.
Yeah. Ooh, yeah.
Into your shoulder blade or into your arm?
Behind.
Yeah. Okay, so I want you to turn your head from side to side. So where do you feel it going right now?
It's like
In-
behind my
in
lung, behind my lungs, sorry, not hurt.
Yeah, yeah, yeah.
Under his finger.
There you go. Can you feel that loosen up? Push up hard against me. There we go. What about this one?
Ooh.
You feel that anywhere else?
I feel like it's just like, ooh, it feels like a guitar string.
Yeah, it does. This is more sadness and holding on to things, because it's blocked in the metal element. You feel that thumping when I'm rolling over that tension there? There we go. You feel that loosen up?
Mm-hmm.
Pain gone?
Yeah. Well,
Good. Better?
mm-hmm.
Okay. So now we already looked at this. Any pain there?
No.
Okay, we looked at this. Any pain there?
No.
Okay. Give me both of your arms. Turn your arms around. Push up hard. Turn your head to the right as much as you can. Right as much as lean your head back as much as you can. Push up. You feel the difference?
Wow, I could not do this before.
Yeah. Push hard into my hand. Relax. Stretch. Push hard into my hand. Better, huh?
Mm-hmm.
Push your arm back against me. Push back. That's easier too, isn't it? Stand up. Turn this way so everyone could see. Can you guys see the angle of her shoulder blade right now? So the shoulder is dropping back and coming down more because I relaxed the muscle here and I relaxed the muscle here. Okay. Push hard against me there. Good. Stretch. Push hard against me. Good. All right. Relax. Okay. Good. How's that feel right now?
Feels really good. I feel like there's a lot of circulation kind of going.
Good.
Okay,
Good.
yeah.
Well, thank you.
Thank
Thank you
you.
for coming up.
Thank you very much.
And thank you for being so brave, because you never know what's going to come up.
Toby, how much is your book?
$10. Yeah. 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 Yeah.
So it just reminds you on one of his patients. And he grinds it, it hurts.
Yeah, no. And you're using your...
Yeah, 2 fingers. Yeah, we're going to talk about that. We're almost done. I'm just going to do one. I know we've gone over, so I'm going to do one more thing, so I'm going to finish this, wrap this up, okay?
Okay, so I made a email sheet if anyone wants to add their email. And
I gotta go, but I'm interested in the,
In the workshop?
yeah.
Yeah. Thank you for coming.
Thank
I
you
really
for being
appreciate
here.
it. Yeah,
It's
thank you.
fascinating work.
Thank you. Thank you.
is that okay if I say one thing?
Yeah. Oh, yeah, yeah, yeah.
Okay.
Yeah, but I'm not. I'm gonna.
Oh, are you
yeah,
not
I'm not.
done?
I'm just going to finish up one more thing, and then you could say something.
Sorry, I thought you
Yeah.
were done.
No. So what I want to show you is just two more things. Then we're done, because you always have to go with the flow. We had problems with the software. The screen is not the greatest. You know, couldn't hook up to the software. So there's always something going on. But basically, there's two things I need to get covered. One is therapy localization. In AK, applied kinesiology or muscle testing, the word therapy localization refers to when you test the muscle and it's strong, and then you touch where there's a reflex point that is out and the muscle goes weak. So indicator muscle testing means a strong muscle will go weak or a weak muscle will go strong. Remember, when we were doing this test, when I pushed her arm back, she couldn't do it, but when I touched here, the pectoralis minor, she got stronger. When I touched upper trapezius, she got stronger, because these were two muscles where she had tension that caused that muscle to be weakened. So therapy localization is when you touch somewhere while you do the muscle testing, so it becomes like a point finder. You guys seen the point finders in acupuncture? Because it's going to pick up anywhere in the body where there's tension. It measures the ability to resist in the muscle test is picking up if there's any tension or any stress in the body in that place. So you have both the posture, which is obvious, which could see changes. Her shoulder went like that to that. The range of motion, you saw she couldn't move her head to she could move all the way. She couldn't come down to where she could go down a lot more. And what makes it hard when you demonstrate is that I'm focusing more on you instead of her. If my focus was on her, I could be even more exact, because I don't have to tell you guys what I'm doing at the same time. But so therapy localization is what's important. And then the final thing that you notice me do is, how do you inactivate the reflex point? Okay? That's what I call depolarization. And I want you to tell everyone what happened, and Kirby could tell too, and Claire could tell too, because you experienced it. The pain at first could be almost excruciating. Very often you feel a radiating sensation of pain or numbness or tingling or warmness or electrical. And then it's like, and you could feel sometimes a tight band or a tight guitar string, and then it's like it just goes, and it's almost like a feeling of well-being. It's like, oh. And so when you hit the person with the first point, you say, what the heck are you doing? It's going to kill you, whatever. But then after a while, they start realizing, oh, it takes about 30 seconds, and then it feels better. And then they start trusting. And it becomes a way of letting go. And what I'm doing is I'm basically going and provoking the area of tension. And at the same time, we're talking about some of the things that might be causing the tension. So now she released not only physically, but she also see the connection between her tension and some of the things that is stressful in her life. And if she was my patient, I would give her very specific homework to do, to work on, because I wouldn't see her for 4 to 5 weeks. Okay? So depolarization is then when I find the spot, and as I find the spot, I could go in different directions. When we were doing acupuncture, we were pushing the needle, and I don't know if you guys do, to find the chi, we're basically poking around, and then boom, when you find it, as I remembered it, it was almost like you went fishing. The needle sometimes starts going or jerking by itself, and the person then feels that sensation of chi, and you know, boom, I hit it, you know. So what I'm doing with the muscle testing, I'm actually testing real quick which way to apply the pressure, which direction. And this is interesting because I got this from Travell, said that she used to inject the points in direction of a 5-star because she noticed that some directions she get more of a hit. And I have found when I release it, that sometimes I have to release it in more than one direction. And then I draw the conclusion that each direction is one of the 5 elements. So if I'm on the gallbladder, muscle meridian, and happen to get in the area of, this time was lung 1, which is in the pectoralis minor, but the gallbladder muscle meridian goes over there. and I'm working in the direction of metal, then it could be a blockage that has to do with decision making and speaking up, and it could be related to the imbalance in fall with wanting to please and having an imbalance between receiving and giving. Do you guys follow me? And so I'm kind of communicating with my patient all the time based on which season that shows up, because I'm using the knowledge of the 5 elements to communicate with them and the blockages in the different seasons. So I'm using 2 fingers together like this. I support one finger with the other, and I'm working like that. If you notice, when I worked on her hip, there was a time I used my elbow because it's a deep muscle. But I applied the pressure in the direction that the muscle testing showed me. And sometimes I apply pressure in one or more directions, whichever show up. And when I do this right, it gets to the point to where the point doesn't hurt at all anymore. And when I do that and I try to test the point, the muscle doesn't go weak anymore because there's no tension there anymore. Do you guys follow me? So this is how this is done. First of all, find where is the tension in the body. By looking at where the pain is, or this happened to be along the large intestine and gallbladder meridian. Okay. 2, what is the posture faults? Well, her hands was turned in. When she laid on her back, this shoulder was coming forward, and when she stood, her shoulder was forward like this. Range of motion, she couldn't turn her head all the way forward. She couldn't come all the way forward. And when I did this test, her arm went weak. And then muscle testing, when I tested the pectoralis minor and stretched it, she went weak. When I tested the upper trapezius and stretched it, she went weak. When I tested the scalenes and stretched them and tested them again, they were weak. That means all of those were contracted. When I tested the lower trapezius, she went weak right away, which means that muscle was elongated. And all of those things, every single one of those things told me something. Do you see what I'm saying? And when I enter them into the software, which unfortunately is not demonstrated well because you could hardly see on the screen, but basically I just fill in the box. Yes, she has this. Yes, she has this. Yes, she has this. Then the software tells me exactly which meridian, which muscles that are involved. So in one muscle, the upper trapezius, for example, showed up on 4 or 5 different of the tests. Do you follow me? The pectoralis minor showed up on 2 or 3 of the tests. And so now I get a form of priority because of all the tests. Some of the tests is for the same muscle. And if you noticed, it also showed me which meridians that showed up most. And since it's not always the one that showed up most, the one I use muscle testing to test the end point or the starting point for the muscle meridian. And I got a read, so now her body told me which one to start on. In this case, I picked the gallbladder and the large intestine. And I have never met her before in my life. And I'm able to kind of draw up some kind of conclusion, the intolerance to greasy food, having a hard time saying no, but in the past it was worse. Now it's mostly with one person. You know, in the past having relationships where she had an imbalance where she was giving more than she was receiving, which is a fall metal imbalance, and a problem was speaking up or saying no or expressing what she needs, which is a spring wood gallbladder imbalance. And so all of this is pulled together to tell me through the muscle testing, through the tests, through where the pain is, through the communication, which points to use. And then when I hit the points, she could feel sensation of chi moving along the meridian. She could feel the pain, and as we're talking about what's stressful, the pain sometimes gets worse. At one point she felt like she wanted to cry when I was up there on the line, holding on to all that past pain of giving and being taken advantage of and not being able to speak up perhaps. And I'm just assuming now because that could have been it. And then when I'm then releasing the tension and she's thinking about this, I'm working on the mind and the emotions and her recognizing the pattern and drawing the connection between the pattern repeating itself and the suppressed emotions and the tension and the numbness in the arm and the stiffness in the neck. You guys follow me? And then if she was my patient, I would then, after I release this, I might give her stretching exercises of the upper trapezius, of the pectoralis minor, and even giving her something to strengthen the lower trapezius. I might give her breathing exercises because of the tension in the scalenes. And I might give her something to read from my book about gallbladder, about speaking up, and about large intestine lung being able to give and receive in balance and being able to let go. So that now I'm dealing with this from all sides. And so I want to take a quick point and ask 3 of you who've had this what it feels like for the people who didn't get to feel this. So Kirby, you've been treated too. So why don't you tell people what it feels like when you work on those spots?
It hurts really bad. I'd say that's probably the only side effect of the treatment. But it doesn't hurt very long. And it clearly goes through that phase of like sharp shooting pain, then kind of a more radiating type of pain, and then it really just stops. And then everything else is great.
Yeah. Is that what you felt too?
Yeah, I feel like it was in certain places excruciating at first, but like you said, like after you've done that a couple of times, especially after you got to the hip, I was like, okay, this will pass.
Yeah.
But somehow you would get distracted because as that's painful, you're thinking about whatever you're like asking, the questions that you're asking, like you're trying to make those connect, so you're distracted by whatever you're actually doing to you, whatever's actually being done to you.
I'm actually provoking the point by stirring up the old shit again, if you think about it.
You know, you're kind of like stuck there with it.
Yeah. Claire, what do you want to say? Because Claire's been my patient for many years, and her whole team, she used to play tennis at St. Mary's in college, and her coach it's so cute because all the girls on the team pretty much has been my patients at one point or another. And with every injury, even with athletes, there's always some mental or emotional component. And it's very interesting. Their coach is like a mom for them, and she's just bringing them over there, you know. So.
Yeah. What I could say is, my description of it is it hurts really bad at first, and it's like, it feels like you found the most tender point on your whole entire body. And what she does, because he finds the point of most tension, and it hurts really bad, but then for me the feeling, it kind of releases like water. Like that's kind of how I describe it. It just kind of goes like that. And what I could say about it too is he said average is 3 treatments. For me, he's treated my back, my plantar fasciitis, shoulder. He's done my knee. He fixed my heartburn in a session, and I had just been put on proton pump inhibitors. And I had only been on him for a week, thank God, but that's not even what I went in there for. But so I've seen him for various things, and for me, it's fixed it the first time. So that might be because I'm younger and I heal faster, but my average wasn't 3 treatments. It was better in 1.5 hours every time.
There is a lot of people that get better in one visit.